Welcome to today's lecture on the fascinating topic of aromatic amino acid metabolism. In this lecture, we will explore the intricate pathways and regulation of the metabolism of phenylalanine, tyrosine, and tryptophan, as well as their crucial roles in human health and disease. Phenylalanine hydroxylase deficiency is an inherited disorder that disrupts the normal breakdown of the amino acid phenylalanine. This enzyme deficiency impairs the conversion of phenylalanine to tyrosine, leading to an accumulation of phenylalanine in the body. As a result, phenylalanine levels rise in the blood and can cause severe neurological problems, including intellectual disability, seizures, and behavioral issues. Early diagnosis and treatment, such as a low phenylalanine diet, are crucial to manage this disorder and prevent long-term complications. Tyrosine, derived from phenylalanine, undergoes various metabolic reactions to produce important neurotransmitters, such as dopamine, norepinephrine, and epinephrine. These neurotransmitters play critical roles in regulating mood, motivation, and cognition. Dysregulation of their synthesis or signaling pathways can lead to psychiatric disorders, including depression and ADHD. Tryptophan is an essential amino acid that serves as a precursor for serotonin synthesis. Serotonin is a neurotransmitter involved in regulating mood, sleep, appetite, and pain perception. Its dysregulation is associated with psychiatric disorders, such as depression and anxiety. Tryptophan also serves as a precursor for niacin, vitamin B3, synthesis, which plays a vital role in energy metabolism, DNA repair, and cellular signaling. Tryptophan metabolism can be diverted into the kynurenine pathway, leading to the production of various downstream metabolites. These metabolites have immunomodulatory and neuroactive properties. Imbalances in the kynurenine pathway have been implicated in the pathogenesis of neurodegenerative disorders, such as Parkinson's and Alzheimer's diseases, as well as autoimmune conditions and mood disorders. The breakdown of aromatic amino acids, including phenylalanine and tyrosine, plays a crucial role in energy production. Through a series of enzymatic reactions, these amino acids can be converted into intermediates of the citric acid cycle, generating ATP for cellular energy. Disruptions in this pathway can lead to metabolic disorders, such as phenylketonuria, where energy production is compromised and can result in developmental delays and intellectual disability. The activity of phenylalanine hydroxylase, the enzyme responsible for phenylalanine metabolism, is tightly regulated to maintain phenylalanine levels within a normal range. Mutations in the gene coding for this enzyme can lead to metabolic disorders, such as hyperphenylalanemia. Understanding the mechanisms of regulation and the impact of mutations on enzyme function is essential for the development of targeted therapies for these disorders. Several genetic disorders are associated with defects in the metabolism of aromatic amino acids. These include alkaptonuria, Hartnup disease, and tyrosinemia. Each disorder is characterized by specific enzyme deficiencies or transport defects, leading to the accumulation of toxic metabolites and various clinical manifestations. Early diagnosis, dietary interventions, and specific treatments are necessary to manage these genetic disorders effectively. Catecholamines, including dopamine, norepinephrine, and epinephrine, are neurotransmitters involved in the transmission of signals between nerve cells. They play critical roles in regulating various physiological processes, such as the stress response, cardiovascular function, and movement control. Imbalances in catecholamine synthesis or signaling pathways can contribute to the development of neurodegenerative disorders, such as Parkinson's disease. Aromatic amino acids, particularly phenylalanine and tyrosine, are essential for the synthesis of pigments, such as melanin. Melanin is responsible for determining skin, hair, and eye color. Disorders affecting the metabolism of aromatic amino acids can lead to abnormalities in pigmentation, such as albinism or hyperpigmentation disorders. Serotonin is a critically important neurotransmitter involved in regulating mood, appetite, and sleep. Dysregulation of serotonin metabolism or signaling has been linked to various psychiatric disorders, including major depressive disorder, anxiety disorders, and obsessive-compulsive disorder. Understanding the complex interplay of enzymes and transporters involved in serotonin metabolism is crucial for developing pharmacological interventions targeting these pathways. In addition to its role in neurotransmitter synthesis, tryptophan metabolites also play a vital role in immune regulation and inflammation. Activation of the kynurenine pathway, stimulated by pro-inflammatory cytokines, results in the production of metabolites with immunomodulatory functions. Imbalances in this pathway have been implicated in autoimmune diseases, chronic inflammation, and even cancer development. Defects or dysregulation of aromatic amino acid metabolism can contribute to the development of various diseases. For example, Abnormalities in phenylalanine metabolism can lead to the accumulation of toxic metabolites associated with neurologic damage and intellectual disability. Understanding the molecular basis of these disorders and the underlying metabolic perturbations is essential for the development of effective diagnostic methods and targeted therapies. In conclusion, the metabolism of aromatic amino acids is a complex and tightly regulated process that is crucial for human health and disease. Dysfunction in these metabolic pathways can have profound effects on neurological function, neurotransmission, immune regulation, and pigmentation. Understanding the intricate molecular mechanisms involved in aromatic amino acid metabolism opens new avenues for therapeutic interventions and diagnostic approaches for a wide range of disorders. I hope you found this lecture informative and gained a deeper appreciation for the intricate world of aromatic amino acid metabolism. Thank you for your attention.